So this patient didn't fail hormone replacement therapy. She was just overdosed on testosterone. Hi, this is Michelle. I'm a functional medicine pharmacist. And I had an issue this weekend where a patient had called and she had been using testosterone topically. After about a week or two, she was feeling good. Then about week 3 or 4, she started losing all of her hair. We discussed dosing, and I see this a lot. So the patient was given 20 milligrams topically per day of testosterone. For reference, women make about 0.2 or 0.3 milligrams per day of testosterone in their prime. So this woman, even if you were adjusting for bioavailability, for how much was actually being absorbed from the cream, that is still significantly too high. So her DHT had become extremely high, and that's why her hair follicles were then being attacked by the DHT, which is a metabolite of the testosterone being too high. So she did like at first the energy that she got from it, the increase in libido. We were very happy about that for her, but she was not going to be continuing just because of the hair loss, understandably so. Progesterone isn't only for sleep and mood, it also affects how testosterone affects the hair follicles. Hi, I'm Michelle. I'm a functional medicine pharmacist, and this is a continuation of yesterday's topical testosterone therapy patient. She went ahead and brought me her labs yesterday so that I could take a look, and I noticed that her progesterone was very, very low. She was put on a very low dose of progesterone topically, which sometimes is very, very appropriate. But with this patient specifically, her progesterone was not anywhere near where it needed to be starting testosterone therapy. I always like to fix progesterone first so that it protects that patient from, in case their testosterone does get a little bit too high, in case they're really sensitive to it, it will protect them from having a lot more increased anxiety, decrease in sleep, and particularly at the hair follicle. So progesterone, it modulates how testosterone acts at the hair follicle. There is something called DHT that testosterone converts to locally in the tissue at the hair follicle. So whenever someone's testosterone gets too high and they don't have enough progesterone, their DHT most likely is going to get too high, and that's going to cause significant hair loss for a lot of women. It's really important to watch this and make sure that anyone that's starting testosterone therapy is aware to be on the lookout for that. And then also it's good to just make sure that progesterone is taken care of before we even start the testosterone therapy, just to kind of get that extra layer of, padding